Do you have a Cover California plan, and are you concerned about what is happening with the rates going into 2026? Hi, I'm Tommy at medicalinsurancetoday.com. We have a perfect storm brewing in 2026 around healthcare, amongst many other things that are happening in our country, and I am here to help deliver the actual signal of what's happening and to sort out through the noise that is out there. So I have a lot of clients daily that we're talking to that are really, really concerned, and many rightly so. However, I'm here to help quell some of that fear and offer some solace as to what's going to be available going into 2026 and what's actually happening. So in the Cover California Exchange, that is California's exchange, Cover California. What the exchange means is based on your household income, you could potentially qualify for a discount based on your income off of the cost of your monthly insurance. So if you have health insurance and you're lower income, you get your insurance at a discount. Now, historically, there's an income chart. I'm going to flash it real quickly because it's a real boring chart and it's not fun to look at, but it gives us a detailed look at what is actually happening to these subsidies. Historically, since 2014, when this all went into motion with Cover California, if you have income below the 400% mark on that chart, based on your household size, you then start to qualify for discounts, and as your income goes down, you get more discount and your monthly cost goes down. So it's been helpful to a lot of folks that don't make money to qualify for health insurance. Now, in 2022, there was a ton of money injected from the Inflation Reduction Act into these statewide exchanges, and for folks to qualify, that if you were over this certain threshold over here, if you were over this 400% mark, that you would still be able to qualify for some financial help. Now, there were limits on that. If you made $1 million a year, you weren't going to get any help, but it helped a lot of folks, myself included, that if you're over that threshold, you were going to get some financial help. And what is happening now, and the signal versus noise component in the media, is that you're hearing that the subsidies are going away. Subsidies are not going away. It's just over that 400% threshold, they are going away. So if you're below that threshold, you will still qualify for a discount, and the lower your income goes, the more discount you get, and the less you're going to pay for your health insurance monthly. Those subsidies were set to expire in 2025. So there's been a lot of talk in the media, and this is the noise, that the subsidies are going away and that the sky's falling, Chicken Little kind of stuff, and that Republicans are taking away your health care kind of deal and all that good stuff. That is not true. If you are below the 400% threshold, the system will operate just as it historically has, and you will qualify for a discount. It's the folks that were over 400% that have been benefiting the last 3 years that are no longer going to qualify for that help, and they're going to pay just the full cost of insurance. Insurance is still going to be available for everyone. Everyone's still going to be able to qualify for health care, and it's just going to be expensive if you're over that 400% mark, unfortunately. Now, the double whammy, the perfect storm that's brewing is with this loss of subsidy for folks over the 400% threshold. You also have the biggest rate increases on record that are going to happen in Cover California coming in 2026. So the state, it measures out an aggregate rate increase per all the counties in California, and the aggregate combined rate increase averaged out over all the counties is going to be just over 10%. Now, historically, it runs in that 4, 5, 6. Average is about 5% aggregate. So you're going to see about double the rate increase across the state. Now, I looked at some charts this weekend and did some reading about nationwide what's happening there. I believe like 14 or 15 states are going to see an aggregate of over 20% rate increases for the year of 2026, which is astronomical. So in healthcare, these insurance companies, even though they all have a bad name, and in some cases rightly so, but I tend to believe that it's misaligned and misinformation that's going out there about the big bad insurance companies. The insurance companies have to pay claims, and they have to be able to pay off the medical debts that happen for people when they're insured. And historically, they've been repressed on their rate increases. Now, insurance has gotten out of control expensive. I'm the first one to admit it. I have no issue claiming that insurance companies are charging way too much for health insurance. But due to the laws and all the claims that are out there and all the people that are guaranteed to be given coverage, they are still running a business. Insurance companies are a business, and they have to be able to keep their doors open and pay their people and to pay their claims. Under the Affordable Care Act, there were a lot of internal laws that were created, internal rules for insurance companies that were limited on their profits at the 20% mark that they can actually profit. And then they have to use that 20% to then pay their staff. But that aside, the insurance company rate increases are going to be crazy in 2026. I'm not justifying them or defending them because I am subject to them personally as well, and I hear it from all my consumers every day about how frustrating, and with the cost of living and the cost of goods out there, how expensive things are getting, and it is out of control. The Affordable Care Act has not really helped make insurance more affordable for anybody except for the folks that don't make a lot of income. For the rest of people that are, working folks, if you get it through a job, your employer is paying a tremendous amount of money out of their pocket to provide you those benefits. If you buy it on your own, you see it on the monthly how expensive it is. I mean, my insurance for my family of 4 is going up over $1,800 a month next year, which is an astronomical number in my view. 10 years ago, before the Affordable Care Act, it was probably going to cost $500, maybe $600 a month for that same policy, or very similar. That said, the rate increases are going to be out of control. And here's where any agent, my agency, Medical Insurance Today, can come in and help you. We charge zero cost for our services to quote you, to talk with you, help walk you through what's available. We work with all the carriers out there across California so we can show you everything that is available to you. And our interest is in helping you find a plan that suits your needs and is affordable for you monthly. And in many cases, there's going to be people that are going to go uninsured in 2026. This is something I've been talking about with my agents and my staff, that there's going to be people that just flat out are going to refuse to pay for insurance. I know that that's happened in years past. And with this year coming up, it's just going to flat out not be affordable for a lot of people, unfortunately. I don't know the fix. That's a long discussion. That's an hours long and days long discussion of what the fix is to make insurance more affordable again. But at this point, we have to face reality. People need to remain insured. There's still a tax penalty for not having insurance. And without insurance, you run the risk of going bankrupt if you don't carry a policy. So a lot of people are going to be moving from, silver and gold coverage down to a bronze plan just to keep catastrophic coverage to protect their home and their assets, to make sure they don't go bankrupt if they get hit by the proverbial bolt of lightning, I like to say. But you need to keep a major medical policy. So we are here to help our consumers figure that out, show you the rates, walk you through what, doctor networks and what the ins and outs are of bronze versus silver, and go into great detail with you to help you figure out what could be the right change or the right plan for you if you do need to change and can't afford the plan that you have. So please search us out. We would love to help you. We plan on being busy, so get to us early. The open enrollment begins November 1st. If you actively have a Covered California plan, that begins October 15th to renew it, so you can start next week. We would love to help you. Please be in touch, medicalinsurancetoday.com, and we look forward to serving you.